My name is Lynn Goldstein. I'm a registered dietitian and I'm a guest speaker at Integrative Nutrition. So when I first heard about the program, that it was a training program, they were putting out health coaches, I was skeptical in the sense of, do you really think you can put out someone who can do my job in the span of time? But when I learned that there really was a need for both, there's room for both a registered dietitian and a health coach in the society, and I think that I learned a lot. I think I definitely work with people differently. Obviously I came in already knowing the medical, so I didn't need that piece of it, but I definitely learned a different way of working with people, so I actually got a lot more out of it than I expected. Someone that comes out of this school, there is a difference in who you can work with, and I think knowing that you necessarily can't work with the very sick, or you don't have the experience to work with someone with a lot of disease problems and a lot of medications. However, there's a good, huge majority of people in this country that don't have these very intense medical problems, and they do need some guidance by someone. And it doesn't necessarily have to come from a registered dietitian. It's someone who has a knowledge of how to live in a healthy manner, how to incorporate healthy foods, how to incorporate exercise, and that can come from any number of sources, and I think health coaches fit in nicely in that realm. I think I actually started talking to my patients or clients that I was seeing much more than I ever did before, instead of just getting the facts of what medications are you on, what symptoms do you have, what supplements do you take, and then talking at them. Okay, this is what you need to do. I actually stopped and asked them a lot more questions about what they thought, what they felt, what they wanted, what their goals were, and really I got to know them as a person much differently, and I think that really changed how I counseled somebody.